welcome to Holistically Speaking. I'm your host, Morella DeVoe. Our mission at Holistically Speaking is to be the avenue through which the voices of holistic health reach you at the time you need it most. And my guest today is James Henley. He's the founder of Body Resolution. And I decided to invite James on the show because I had quite an eye-opening experience with James going through his assessment at his gym. I was actually getting pretty fit. I was working out very vigorously and consistently, and I started noticing that there were parts of my body that weren't feeling so great. And I met James and I spoke with him, and in doing the assessment with him, I realized that there were imbalances in my body that could potentially lead to injury, and I thought it would be a great topic to bring to you because I think a lot of us in our quest to be healthy and fit might maybe putting ourselves at risk or not doing things properly, and so I wanted to share that with you and share with you everything that James has to offer us. So welcome, James.
Well, thank you very much for having me today. I appreciate it.
Yeah, thank you for being on the show.
It's wonderful.
So tell us a little bit about your approach to fitness, because it's slightly different, and that will set the stage for what we're going to show people.
Yeah, you know, Body Resolution was founded on the principle of the kinetic chain, basically how the human body moves. And it really is eye-opening when you look at how the body moves and then you look at a dysfunction of how the body moves. And my goal has always been to make sure that the body moves in a fluid format, in a full range of motion. And so that's what the kinetic chain evaluation was based off of. So that's where we came. When we met each other, that's what we were working on. I wanted to see what type of dysfunction you had in your body. And it might not even be called a dysfunction, but some type of muscle imbalance that you were experiencing at the time that you might not even know about. And so you start doing this, you're doing these exercises and you're so happy and you're really pushing yourself and things are going great, but you don't notice that maybe you have a couple things taking place that are going to eventually lead to some type of injury. And it might just be a small injury. It could just be like a little tweak in the knee or a little tweak in the back. But I see people all the time. They start off and they're ready to work out. They love it and they jump right into the fitness thing, and they don't understand these little imbalances that take place through their body throughout their whole life.
Right. And so what are some of the most common imbalances or dysfunctions that you see?
So in the movement patterns, you'll see things from like an excessive forward lean, your arms dropping down when you're doing overhead squat, knees coming together, ankles collapsing. Those are kind of the pathways that it takes place. But then that's caused by basically three things. You'll have like a reciprocal inhibition, right?
Can you translate?
So it's when you decrease neurological drive to one muscle group, so another muscle group overrides for it. So a lot of times you'll see a reciprocal inhibition leads to what we call synergistic dominance. Another one of those really fun ones.
That's number 2?
Yeah, that's number 2.
Okay.
Synergistic dominance is where that primary mover is no longer functioning at the level it's supposed to. So another muscle group, like you might have your glute medius not active as much as possible. Your butt muscle is not active. So your spine erectors, your QLs take over for it.
So that means that, and I'll just use my own example, that I was noticing like my quads getting super strong, but I wasn't able to recruit other parts of my legs.
Exactly.
And so these will get stronger and stronger and stronger.
Exactly. Your brain maps it for you, and once it maps it, it kind of sticks to that same pathway. See, the body is amazing. It seeks the path of least resistance at all times. So if you teach it to fire your quad every time you do a squat, it will learn that, and it will keep doing it. And then eventually you'll start feeling a little bit of pain right on top of the kneecap, right? Because that tension is pulling up on the kneecap and pressing it in a little bit tighter and tighter. So you can see, like in that situation, specifically, a lot of people have quad dominance. You'll have tight hip flexors, and when you talk about tight hip flexors, that means your body falls down, which means your low back is exposed to injuries.
Right. Which is exactly what happened when I first spoke with you, that I was telling you that I was having this pain on the top of my knees and just couldn't figure out what was going on.
It's frustrating, right? I mean, you were out working out as hard as you can, probably what, 3-4 times a week?
More.
More? 5, 6? I think she works out more than I do. Don't let anybody know that, though, okay? So you're out there working out, and the next thing you know is these little types of pains, and those are your indicators. Those are when your body starts to tell you, hey, easy, there's something going on here you need to be aware of.
Right.
And unfortunately, because you haven't been studying human movement, not all of us do, not all of us are knowing all this stuff, so when you don't study it and you keep doing the same movement pattern over and over again, you get pattern overload. When you get pattern overload, that's where you start to fall into a pain or an injury.
An injury. So you've told us there's two, and I forgot the names, but you told us two.
So you have reciprocal inhibition, and then you have synergistic dominance, and then there's altered length tension relationship. That's the easiest one. And all that really means is that when your body is in a state of not moving, basically, you'll shorten up certain muscle groups and other ones will be lengthened. So if you talk about like us seated in this position, my leg crossed over, I've got a shortened hamstring, a shortened hip flexor. You're sitting the way you are, your feet, your heels are slightly elevated, you have shortened calf muscle, shortened hamstring, shortened hip flexor. When you go to stand up for a fully functional movement pattern, those areas, your brain remembers that and it keeps them short. And so what you see is over time, we spend more time sitting than we do moving.
Yes.
Right? So we have that issue.
And that was exactly what was popping to mind as I was hearing you speak, that I noticed after years of sitting down at work, I noticed that my hips feel very tight, and then I stand and, you know, I just feel like a discomfort. It's harder to stretch them and all of that. So that's what that number 3.
That's what that number 3 is. And there's other ones out there, but those are the primary ones you see the most of. The amazing part about it is you might not notice it at all, but if you have one gastroc that's shorter, and that's your calf muscle, if you have one calf muscle shorter than the other or tighter than the other, it causes all these dysfunctions all the way up to the kinetic chain. So we might find one section where you have a rotation in the hip forward, and that's caused by the gastroc. But because that hip is rotated forward, your left shoulder will actually be pronated. It'll be forward in that position, which shortens the chest muscle, which means you have an overactive trap on this side. So it goes all the way up that chain.
All the way up.
Right.
So then I'm hearing you say this, and I'm thinking, well, what's going on for me? You know, if I have some pain in my left shoulder, it could be related to my hips or,
Right, so when we do the evaluation, that's what we're trying to find. That's the most important. And then we build a corrective exercise program based on that.
Tailored.
Because it really, fitness is not, I mean, it's about getting in shape. It's about having, it's about feeling better about yourself, being able to move better. But really, fitness is about injury prevention. So we don't blow out an MCL or an ACL, or we don't have rotator cuff problems or things like that. So we have to, it's a little bit of a paradigm shift where you have everybody thinking concentrically, like doing curls and this way, or doing squats. But really, the most important thing to take away from it is how you approach that movement pattern. So how do you get into that?
Well, and it's also, I guess, about functionality versus just, having big biceps or whatever. Can you actually move and...
And if you see most of the guys with the big biceps, they do have pain somewhere in their body, right? It might be with their shoulder. And, that's one of the biggest things when I first started understanding this was when we were doing chest press, and I was doing it with dumbbells, and this is back 12, 13 years ago, and I pressed up and my left arm just dropped out, and I could not figure out what it was, but it was pattern overload. When I went to do my chest press, I'd push my shoulders out. I'd push them forward. I wasn't using my lat muscle to hold it down. So as soon as that happens, that's when reciprocal inhibition took place, shut down the arm basically, and my whole arm just fell right to the floor. It was really bizarre to me. So then I started studying, and that's what basically made me go to school for it.
So you made me dress like this for a purpose. So we're going to show viewers essentially a little bit of what you do in a kind of an assessment, right? And watch me fail.
That's not true.
So shall we?
Yeah, let's go. Let's do it.
So we're going to step over.
So the first thing we want to have you do is an overhead squat. And like we said before, you want to make sure that you're trying to go through the whole alignment process, right?
And
so don't show off too much for all the viewers today, okay? Let some stuff slide, right? So we're going to go arms straight up overhead, and the goal is to keep your bicep in line with your ear as you do this. Shoulders pulled down.
That's all right.
Yeah, it's up there. You want to keep it right there. As you go down into that squat, I want you to try.
Oh my God.
Yeah. You want to try and get your thighs all the way down parallel to the floor. So we're just going to go get a little lower. Good. And what you see here is, go ahead and push back up. Good. How'd it feel, first of all?
Awful.
You loved it?
Yes.
It was great,
It was great.
So let's turn sideways, and we'll show a side profile. right? I want you to do the exact same thing, okay? Arms really up, get that. You want, it has to stay, the bicep stays right by the ear, so we're gonna drop back down through. So this is what you see is an arm drop, right? We have a sample arm drop picture. Good, and we'll push back up.
Okay.
Good, how do you feel? You sweating yet?
Yes,
Aren't you glad you wore that clothes?
So that's what I look like?
So that's what you look like. You see your arms falling forward a little bit,
yeah.
right? The line is supposed to stay up straight, and your thighs are supposed to get to, parallel to the floor. That's our biggest goal.
Okay.
Okay, so that's called an arm drop. What it tells us from there is that obviously you have really tight rotator cuffs. So you're not able to extend the arm.
Yeah.
You have a tight latissimus dorsi, which is this muscle group that runs under here, okay? And it goes all the way down to the lumbopelvic complex, which is your pelvic bone region, right? And so when this is tight, it doesn't allow for those arms to go all the way up.
Yeah.
So there's two places you can increase range. You increase range in your lat muscles, or you increase range in your calf muscles.
And what would ultimately be the injury pattern if I didn't correct
if you're
that?
not able, so you'll see a rotator cuff injury. Kind of like I was talking about when I'm doing my chest press and that reciprocal inhibition takes place.
And that's why I was starting to feel pain right here?
You'll feel pain. You can feel pain in a lot of different spots. It usually starts up in the trap or behind the scapula.
Well, that's
right?
the first place.
And then it will radiate out, right, to the shoulder.
Because I was feeling fire, like, back
in the
here.
trap, right? So that's your first indicator of an injury. Then you start getting pattern overload in the anterior delt.
Okay.
And you're probably doing a lot of squat and press up front. As you're doing that press up front, this muscle group is saying, hey, hey, easy, easy. You know, this has already been injured and warned, right? So what we can do, there's a couple ways to make it easier on the Connect chain, is put your heels up on these plates. And this is only a ½ inch, right? And you're going to put your arms back up straight. Right, and this is going to take the pressure off your body basically by allowing your shin bone to travel forward. So go ahead down into the squat this time.
That's better.
That's much better. Arms stay up, head stays up a little bit, perfect. And then press back up through. Totally different movement pattern. And all it takes is increasing the length in your calves.
So what that's replicating is if my calves were what?
Lengthened. If they had more flexibility in it, more ability for your knees to travel forward, right? In that position as your arms travel up. Now there's a lot of different things that can happen there. As you go down into that squat, your knees can't travel forward, so it stops your pelvic bone from being able to shift. As that shift stops, your body starts dropping forward, causes the arms to fall down. So
then my work is to lengthen my calves.
Yeah. So in this overhead squat, right now I tell you, you need to lengthen your calf muscles, you need to stretch your quads, you need to stretch your hip flexors, right? You need to work on a pelvic tilt, which is tucking your butt underneath, right?
Yeah.
And then you have to work on retraction, opening up your arms.
Okay.
Right? So now here's an exaggerated
so
form.
You're keeping tabs of all of this.
I'll keep tabs of this. We'll talk about it after, right? So this last one is to show, you know, how hard it is. And basically what you're going to see here is an excessive forward lean. But I want you to make sure you get your thighs down to parallel. Your toes are up on the plates now. And what it's doing is showing what a shortened calf would really do. So
this is already hard.
Just don't fall backwards.
I can't go any further.
So just, you know, do whatever you need to do to change the body. Now you can start to see her whole body shifting forward. So this is an excessive forward lean instead of an arm drop to get her thighs down to parallel. I think we have an image of that as well. Let's show. Yeah. So see how you're in that line comes all the way forward. Your butt starts shifting back because you can't create that range.
It's very hard.
Very hard. Yeah. It's almost a workout in itself just to do that.
Oh yeah. I'm already, my heart rate's already
The beautiful part is you see this all the time in fitness industry. You see people,
I'm not alone.
You'll see trainers training and they're doing the same thing. So yeah, you're not the only one that's up there. So let's put our left leg up on the block, and this is really good for indicating an independent strength because when you have both feet on the floor, you can kind of shift from one side or the other. You can cheat a little bit. This one shows exactly what's going on with this complex. You've got your ankle complex, your knee complex, and your hip complex. So from here, I just want you to step up slowly, and then I want you to go back down slowly. Maybe a 3, 2, 1. That's beautiful. Hold the shoulders back, tip the chin up a little bit, and then we'll do it a couple times. We'll do one more. No, we'll do one more after that. Good. Nice. We'll go one more time. Good. And I want you to stop right there. So what you can see here is here's your hip joint, and if I drew a line straight out from there, your knee is about here. Okay? So you'd want to push your knee out a little bit from there. And then I would try and ask you to step up again through there. And try and hold that knee right in line with the medial toe. Yeah, so try and hold that knee out without falling.
Oh my gosh. Wow.
Much harder.
Oh my gosh.
Much harder. Totally changes the step up. So what you have here, there's a couple different things. One, your foot collapses in a little bit. The knee follows that pathway of the foot. And then you have a glute med, which is a stabilizing muscle that's supposed to hold this knee out in alignment. As soon as this travels in, it changes the arthrokinematics. We have an image of this as well. You can see the line up there. Yeah, that's a single leg squat. You can see the knee moves in. You can see the pressure of the two angles come together this way.
So my knee is caving in.
Your knee is caving in, exactly.
All right. And what would be the injury pattern that would result from this?
So this one you see the most. I would say this is the highest one that you'd see, and you'd start to notice pain radiating. And it can radiate around the kneecap, but a lot of times you'll see that it will come to the inside of the knee, and then it might be deep in that joint on the top. Right, because of the way that they sit together. If you start changing the angles this way, it creates that pressure going out this way.
So this is one thing. I guess we could. Are we done here?
Yeah. I mean, do you want to do some more? Nothing else?
I'm good.
All right. All right. We'll go ahead and sit back down, I guess.
So about the knees, would this be something? For example, last year I was training, I won't even say what race I was training for, but I actually decided not to do it because I was noticing in hill running and that my knees were really hurting. Would this be a consequence of that my knees are maybe not in the proper alignment, or?
Yes. So what we just did is an indicator of what muscle groups you're using that are causing your running to be difficult.
Okay.
All right. So, like I said before, the couple things that we talked about is the tight gastroc. But you have to remember the gastroc is the calf muscle goes up and wraps around underneath your femur bone. So it's part of that knee complex. So every time you take a step when you're running and you're going heel to toe, every time you take a step, that gastroc fires and it pulls underneath on that patella a little bit.
Okay.
Right? And it changes the way that knee can move. And so what you have to do when you come and see me or anybody at Body Resolution, we would pinpoint each muscle group that's not working, and then we would help you reestablish those muscle groups in a firing sequence that's appropriate for the movement that you're doing.
Yeah, to correct all of these.
To correct the imbalance. So then again, the knee in one is one that we see all the time, and you have an overactive adductor group, which is on the inside of your thigh, and an underactive abductor group, which is on the outside.
Right.
And so we would basically work from stabilizing the muscle, stabilizing the knee by getting the inside of your leg to relax a little bit and the outside of the leg to fire up a little bit more, and it would pull that knee back out in.
Right.
And then the same thing with the ankle complex if your foot is flattening out or externally rotated, which you didn't have any of today. I was hoping for one of those. A lot more to talk about if we had that.
So it means I'm already getting better.
You're already getting better, yeah. Because what will happen is if you're doing a squat and you're starting to go down and your hips recognize that you have no flexibility in your hip flexors or your glutes, your feet externally rotate. And what that allows is if you have your acetabulum, which is the socket, and your femur bone is sitting in there, it allows it to pass through because you change the angle at which that femur bone sits in there. So your feet, as you go down into that squat, people do it all the time, they'll externally rotate their feet so they can get lower into the squat and utilize more muscles.
Gotcha. So now that we've seen everything that's going on with me, are there other patterns that you see pretty frequently?
I think the number one you'll see is an asymmetrical shift. I think we have an image of that as well.
Yeah, we have an image that we can show.
Yeah, and see, you can see on this one how far off she is to the right-hand side.
Yeah.
And this is the most dangerous type
of ailment
that you see.
So her hips are shifting. Is that what's happening?
Yep.
To
so you
one
can see
side?
how it stays right in the middle on the first one, and then the second one, her left glute is almost past that line to the right side.
Right.
Right.
And why is it so dangerous?
So in pattern overloading with the lumbopelvic hip complex, which is your hip joint, lumbopelvic hip complex, and I say it 10 times fast, right? When you're talking about putting pressure on it, when you're loading it, right, and you have an asymmetrical shift, it causes compression on either side of the spine, right? And this is where you start seeing the back injuries. And that's why I say it's one of the most dangerous, because once you bulge a disc one side, or one, it will completely stop you from any working out or anything you're going to do. Anybody who's ever blown out their back knows how very difficult it is.
Right.
But two, it's one of the hardest ones to fix because where we talk about, you doing a squat and your knees are in alignment, we lengthen the gastrocs on both sides and we kind of work up the body, but we do it on both sides. An asymmetrical shift means my whole right side of my body is tight if I'm shifting to the right side. So my TFL, my IT band, my lateral gastroc, all down the right side are tight, pulling the hips over. Right? And then I have to independently work the strength of my left leg to pull the hips back into alignment.
So to put it in lay people's terms so that we all understand, so one side of the body is tight and stronger, perhaps?
Tight and stronger, most likely.
And the other side is weaker, looser and kind of caves in.
Yeah.
And so one side pulls
it over, right. And so with that, once it pulls it over, then you'll start to see that rotation we talked about. Those are also, it's called the spinal rotation, where the hip bone travels forward. Same thing, extremely difficult to fix.
So the hip, instead of being parallel, it's kind of shifted.
Shifted forward.
So maybe you're facing forward, but your hips are doing something.
Hips are a little bit out of alignment forward. And then what that does is it creates a tremendous amount of pressure on the right side of the body versus the left side of the body. And you'll see this happen if somebody has like left knee pain. They every time you take a step, they shift their weight a little bit to the right. So when they come into the gym to do a squat, they may not even think that they have anything. But because of a past injury or something that happened on the left side, they have that asymmetrical shift.
They're unconsciously compensating in some ways.
Right.
Okay. So tell me, are there any sorts of typical types of activities or typical types of people that are more prone to being at risk for these sorts of imbalances?
So there's two types, there's two categories I specifically think of. One is kind of like the weekend warrior who, goes out, works out, once in a while. They love to run maybe, and they just continue to run. And you basically get into what we call pattern overload, which is where you're doing the same activity over and over and over and over again. And so you're training those muscle groups to fire over and over and over again. You're never training the other side. Like I'll talk about the core in 360 degrees from nipple line down to kneecap, right? You've got to think about your training that way. If I'm running forward all the time, you need some lateral movement in there. You need something that trains your hamstrings to fire, something that trains your glutes. So you're working in 360 degrees of the body. So that's one category. The other category is the sedentary ones that spend a lot of time sitting. It could be your job or whatever it is. That changes all those muscle groups to be shortened in ways that change how you can move. So those are really the two demographics that you see the most.
Right. So what does, of course, I have a little bit of a sense of how you work with people because, we've we've been doing, and
that wasn't too scary, right?
No, that wasn't
bad.
That wasn't so bad.
Right,
I said it was horrible, but it wasn't so bad.
It wasn't so bad.
No, but what's really exciting is to even, because I've been going to Body Resolution for 3 weeks maybe, something like 4 weeks. And that you're saying there's already a shift is pretty encouraging.
Yeah.
So if you could help share with our viewers, what would happen once you identify what's going on in their body? What would happen?
So it's a systematic approach that attacks each muscle group that's either overactive or underactive. And so that's what we specialize in. Everybody at Body Resolution specializes in being able to make sure you're in a movement pattern that helps activate the muscle groups that you need active or deactivate the other ones. So you might see us do like a little bit of foam rolling, or you might see us do these crazy little glute bridges or band walking, and you're like, well, that exercise is so simple, but you go to do it and it's extremely difficult. That's kind of what you'll see. You'll spend, depending on how bad the ailment is, you could spend up to 3 months working on getting a firing sequence to be appropriate. And then from there, we would then take you through progressions. And progression means basically we start with the easiest form of an exercise. So if you talk about a squat, we do a wall ball squat where you don't have to worry about any pressure. And then we might take it to where you have to do a squat using cable up in front of you or a bar in front of you so you can pull yourself back up. And then we take it even farther and make it to where you're doing it with just your feet on the floor, and then we do one leg, and then we do one leg on a dyna disc, and we keep progressing you, or maybe we add weight to it. But that's what you would see if you came into Body Resolution. You would see that progression all the way through. But our first time together, depending on where you are with your fitness, we would really hone in on exactly what muscle groups need to be developed.
So it's really tailored to each person.
Yeah.
And so essentially what you're doing is strengthening the weaker muscles, lengthening the shortened ones, right?
Yep.
That sort of thing.
Yep.
Oh my gosh, I was going to ask you something and it's kind of slipping my mind.
Uh-oh, I hope it was something good.
Oh, yes, no.
See, it was good,
So,
I told you.
Yes, it was. So, so essentially, is it also the goal to stop working out the ones that are stronger? So, giving those a rest, or do you do everything?
It's about breaking the pattern.
Okay.
That's what it's about. I think you don't need to necessarily give them a rest. You need to train them appropriately.
Okay.
And that's probably one of the biggest areas that people have a hard time with, is they can't change from one to the other. So they don't know. They think a squat is a regular squat, but sometimes, like, if you're doing a squat and I tell you to squeeze your glutes, like, that isn't just enough for your brain to say, oh my gosh, that's what I need to do.
Yeah, well, and what I've learned also in working out with you is precisely how these patterns of moving exactly the same way, you try to do an exercise recruiting different muscles, and you realize, oh my gosh, I don't have the strength. It's just not even there. Right. So you have a little torture device there with you.
A foam roller.
A foam roller.
Yeah.
So why is a foam roller so important?
This is an amazing tool, which I wish I invented, but I didn't. The foam roller is really good for basically what happens is it's called a muscle adhesion, and from overusing certain muscle groups, you get these little adhesions throughout the muscle group, the tissue itself. And it basically, if you thought about a muscle like this and the fibers are aligned, you have blood flow and circulation and oxygen, which is the most important thing for a muscle, right? But as an adhesion develops, it starts doing this. Creates a roadblock, decreases blood flow, decreases oxygenation. So when you use foam roller for what we call self-myofascial release, it basically puts pressure onto these adhesions before or after the adhesion, and it tells the Golgi tendons on either side of the muscle to tell the muscle spindle to relax, and then it allows it to realign. Right, and so you're increasing that fascia by allowing it to realign and establish that length tension relationship we talked about before.
Right.
Because some areas, when they've been overused so much, no matter how you train them, you can't really get that to release. So the foam roll is a great tool to be able to do that, and to be able to not do it without paying for a massage, right?
Right.
Because then not everybody can do trigger point therapy with a massage therapist.
Right.
They can use this, and there's different levels of the foam roller. You can go really soft, as when we started together, right? And you're probably on the hard one now, and it's a lot more difficult.
Yeah, it's quite painful.
Yeah.
Some of the spots are very tender.
And those, you'll typically see the spots that are tender are the ones that you overuse. So like you might feel like that inner thigh part, when you're rolling that out, you'll be like, oh my gosh, that's awful. But then you go to roll out the outside, you're like, that's not that bad.
Right.
Whereas somebody who had their knees going out, right, would be rolling on the outside versus rolling on the inside.
Right. So what I've learned from you, James, is that really this is something that can help just about anybody, whether you're an athlete and, doing a lot of the same repetitive movements and just understanding, where you're strong and maybe where you're weak, or if you're sedentary, well, then even more so, you probably want to understand how you can help your body get stronger. And I think also any age, right?
Yeah.
Seniors would probably benefit to seeing how they can continue to help their mobility, their flexibility, and all of that. Yeah. So we have about a minute left.
Okay.
Is there anything that you missed saying that you would like to share with
I think fitness, people need to change the way they think about fitness. It's about being healthy and being able to move in a fully functional range of motion, and being able to stay injury-free versus just trying to lift the heavy weights.
Yeah.
But body resolution is meant for any age group and can be catered to your specific needs, so you never have to worry about, throwing big weights over your head.
Yeah,
but we can do that too if you needed to, right?
Once you're strong enough,
Once you're strong enough, right.
So what I want to be sure to show our viewers is how to contact Body Resolution if they wanted to have an assessment. So you can schedule your complimentary assessment by visiting their website, and it's bodyresolution.com. And you can also visit their Facebook page, which is Body Resolution. And I also noticed that you have a blog on your website.
Yeah, we have a blog. Covers all types of nutrition or fitness tips. Yeah.
Great. So I hope people do visit you, because like I said, it was really eye-opening for me to notice how some of these patterns were potentially going to hurt me if I didn't address them. So I hope you've learned something today, and hopefully visit Body Resolution to address some of those issues yourself. Thank you for joining us. Thank you for joining me, James.
Thank you.
And we'll see you next time.